My name is Dr. Rasu Shrestha. I'm the Executive Vice President and Chief Innovation and Commercialization Officer at Advocate Health, headquartered out of Charlotte, North Carolina. Yeah, so I think it's really important to make sure that we are patient-centered in the design of the future of healthcare. That's what we've been doing for centuries in terms of making sure that the patient is always in focus in the care, in the health and the care of providing care to our patients. Now we have AI and Gen AI in particular as sort of exponential leaps forward in technological capabilities to really make a difference in how it is that we're looking at both health and care around the patient. And I think the opportunity right now is for us to broaden that aperture from patient-centered care to person-centered care. So the patient will always be in the focal point. It'll always be in the center of our attention. But if we're able to broaden that aperture and really look at, imagine a set of data sets around not just the patient, i.e. when that person happens to fall ill and interact with a traditional healthcare model, a physician or an emergency department, or comes in for an annual checkup or such, to now more of a person-centered approach to care, where we're really looking at holistic health. We're looking at not just getting better from an illness, i.e. sick care, which is what healthcare really is about today, to more of preventative care, well care, but more than that, and more than even the annual physicals, it is about thriving. It is about leading your best life possible. I think that's where AI comes in, right? That's where we have an opportunity to look at multiple streams of data and information and insights and evidence-based guidelines and best practices and protocols, and really contextualize to that N of one, that patient, that person, and the set of circumstances around him or her, the social determinants of health, the motivators, the drivers, things that are meaningful in those moments that matter for that human being that we're actually talking about. So that's the perspective that I bring in terms of the power of AI to really simplify that journey for that person. So we're talking about artificial intelligence and healthcare, and what's really interesting is, as I reflect back on the last, say, 3 decades of us in healthcare embracing digital, embracing technologies, in many ways, what we've done is we've introduced artificial barriers, and I use that word very intentionally, artificial barriers between the clinician and the patient. We've erected a large artificial wall that sits in the way between that doctor-patient relationship or the nurse-patient relationship. And the power of artificial intelligence, in many ways, is actually to bring down that artificial wall that we've erected between the clinician and the patient. I think we have an opportunity to really let AI do a lot of the scut work, do a lot of the detective work. I've been saying for a long time that as a radiologist, I'm more of a detective than I am a clinician. I'm piecing information together. I'm digging for notes, digging for information, looking at prior images, and really trying to piece together the story around what it is that this patient is in front of me for today. And if I can have AI do a lot of that scut work, it frees up my time to really have a conversation with the patient, connect with the patient, empathize with the patient, the stuff that got me into healthcare in the first place, right? Bring back the joy in medicine is what I say, right? And I think that's the power of AI, artificial intelligence, is to make the practice of medicine more human. Mm-hmm. I don't see AI as a magic bullet, a silver bullet. I see AI as a tool, an exponentially capable tool, and a set of capabilities that we really have to embrace. And I think in many ways, the opportunity at hand today for us is, as we reimagine the future of health, to really say, all right, what are some of those things that have worked really well in the last, not just the 3 decades that we've been embracing digital in healthcare, but really in the last several centuries of us practicing medicine. And how is it that we need to flip certain models on its head and really reimagine the future of health and care? And how does AI then help in dramatically transforming those sets of capabilities and processes. So one key element of this really is that interdisciplinary, multidisciplinary approach around how it is that we bring out the best for our patients and for the people and the communities that we're set to serve. And I think that's what we need to do is as we look at how we fundamentally leverage technologies like artificial intelligence, but also teach the capabilities around AI to our medical students and nurses and administrators and researchers and such, is we're not trying to make data scientists out of everyone. What we're saying is everyone needs to have a fundamental understanding of artificial intelligence. And much like how today, there's no physician or nurse that doesn't know how to use a stethoscope. It is just a fundamental requirement. It's one of the first tools that you're handed when you enter medical school. I think that's how it should be for artificial intelligence, at least a fundamental level of understanding, without which I think it would almost be irresponsible for us in training the future workforce in healthcare. And then where we go from there is different levels of specialization or subspecialization, where we have folks who are a lot more specialized in data science, maybe others who are a lot more specialized in leveraging AI to look at evidence-based guidelines and best practices, and others who might be in physical therapy and others. So there are different disciplines, and how we bring together those differing disciplines into a common goal of serving that patient that sits in the middle of the care that we provide. I think that onto itself needs to be thought about deeply and built into even the curriculum that we're putting together, so that we're not just teaching the fundamentals of AI, we're also teaching the fundamentals of interdisciplinary care. As I went through my learning journey and trained in medicine and radiology and informatics, and then when I started down the path of what I'm doing today around innovation and health system transformation and strategy, I also got trained in business. So sort of been a lifelong student, and I still profess to be one. As I reflect on all of that, the moments in time during my learning journey that have really stuck with me have been those moments where I've had the opportunity to really roll up my sleeves and immerse myself, not in textbooks and in lecture halls, but really in the real world environment. And I think that's what we really need to be doing more of as we're bringing in AI into the curriculum around healthcare, is create a lot more of these immersive experiences that allow for, it could be medical students, it could be researchers, it could be administrative folks that we're targeting, and allow for more of immersive experiences that create opportunities for us to tackle some of the struggles and pain points and challenges that are out there, right? And where AI just becomes an enabler, a tool that we're utilizing to tackle real-world data problems or real-world workflow problems or real-world research problems. So, creating that environment where it could be that we're working with health systems like ours, it could be where we're working with industry partners, where we're working with pharma, we're working with startups and others, or a combination thereof. That would be an environment where bring not just a smile to my face, but maybe would want me to want to go back into learning some more again. Mm-hmm. The workshop today was fantastic. I really enjoyed interacting with tremendously enthusiastic experts, not just from Northeastern University, but from other areas as well that came in to Northeastern here in Boston. I love the fact that we talked about a variety of different things, including data and ethics and pharma and medicine and nursing, but we also brought into focus the patient. I thought that was really important. I've always found it powerful, and maybe this is something that could be replicated or done in the next workshop, to bring a real patient, into the conversation, right? Mm-hmm. So if there was a patient on that panel, or one of those two panels, or both of those panels for that matter, how would the climate in the room change? Not just the substance of the dialogue, but even the way that we're approaching some of the questions that were being asked and some of the answers that were being put on the table. I think we need more of that, not just in workshops, but also in the day-to-day of how we look at healthcare and run and operate health systems, or teach elements of healthcare as well. I think there's a general sense of appreciation for the fact that we need to have a patient-centered approach to care, and the things that we're doing in healthcare. But there's also a false sense of comfort for a lot of the folks that are involved in healthcare, that, oh, we understand the patient context. We've all been patients, right? I think that is a wrong construct. I think it is important to bring real patients to conversations like these, and design thinking sessions. And I've seen amazing companies and health systems who have patients in real critical roles. There are companies that I work with that have chief patient officers even now. And I think that is really important, right? To bring in that patient's voice and perspectives, the patient advocacy element to the things that we're designing, because it is about co-creation. It is not us building solutions for the patients. It is us co-creating and co-building these solutions with patients. And I think that's where we can create the highest levels of engagement and stickiness and actual behavior change, which I think will be reflecting itself in the outcomes that will be reflected in the results that we will create.